All right, good morning, everybody. This is Steve Halliday with the RAIN RFID Alliance. Welcome to the RAIN webinar this morning. We're going to get started now. It's a few minutes past the hour. I see we have a lot of people on already with us, so hopefully we'll continue to see people joining as we go through and get going this morning. So this morning's subject is about RAIN in healthcare, improving visibility across the supply chain. We have two speakers this morning, Paul Elizondo, who's with IntelliGuard Solutions, and Kristine Lohman, who is with Terso Solutions. Before I hand over to them for the presentation, we have a few housekeeping things that we need to deal with. First of all, the Antitrust Caution, just to warn everybody that RAIN is fully committed to complying with all of the antitrust laws and that there shouldn't be any discussions that might be in conflict with those laws. And we also have a policy on collaboration and work products in which we don't share any proprietary or confidential information during any of the meetings. And we always remember to be polite and respect our fellow participants. If you have more interest in reading more about either of those two slides, you can go to rainrfid.org about RAIN antitrust guidelines, and they're both fully written out there. So this is the fourth in our series of RAIN webinars. If you missed any of the earlier ones, they're available to you either in the RAIN forum for the RAIN members, or if they were open webinars, then they'll be available on the website. This one, as I said, is RAIN RFID in healthcare. In 2 weeks' time, we're going to have RAIN FC talking about omni-channel sales models, and then preliminary schedule for the 26th of August will be the formal announcement of the RAIN Market Research Report being conducted by a Venture Development Corporation, and we will have somebody from VDC who will present the findings and let you see the report and what the work that has been done. So don't forget to block out every other Wednesday at this time. There are more webinars being set up right now, and we will continue with this for some time. So if any of you wish to do a webinar, don't hesitate to get back in contact with me. For those of you who are not sure, that's steve@rainrfid.org. And some housekeeping. So we are recording this event. The presentation and the video will be available in a few days on the RAIN website, and we will send everyone an email with the links as soon as they're posted. It will take us a couple of days to process the video and get it up, but you will get an email. You are all on mute, and so you can't talk. But we have two ways for you to communicate with us. There is, at the bottom of your screen, there should be a Q&A button. If you press the Q&A button, you can enter text. This is for questions to the presenters. So anything you enter there when the presentation is finished, we will go through and try and answer as many of them as we can. If you've got problems with the webinar, you can't find the Q&A button or some other problem, please don't put those in the Q&A section. Put them in the chat section. That's being monitored separately, and you'll get a much quicker answer if you do that. So remember, the chat section is for immediate problems. The Q&A section is for questions to the presenters. Okay, now I have to work some magic here, and we'll see if we can get this one up, which looks as if we did. So I'm going to hand over now to Kristine, who's going to start the presentation on improving visibility across the supply chain. Kristine.
Yeah, thanks, Steve. I know Paul and I are very excited to be here talking about RAIN in healthcare. If you want to just click it to the next slide, I can kick things off with a basic definition of RAIN RFID. So RAIN RFID is a wireless technology that connects billions of everyday items to the internet, enabling businesses and consumers to identify, locate, authenticate, and engage each item. RAIN is derived from radio frequency identification. It's kind of a symbol for the connection between UHF RFID and the cloud. And just like with many other technologies like NFC, Wi-Fi, Bluetooth, there's a set of standards that are associated with that brand name. So for example, we could totally run with GS1 UHF Gen 2 protocol for communication at 860 to 960 megahertz, version 2.0.1 and ISO 1800063, but it's a little bit easier just to say RAIN. And I know that, you know, today more than ever, we're experiencing technology in a new way, especially with COVID, and we're realizing the importance of technology in our world. And things like Zoom allowing us to connect from afar has become really a powerful tool. And just like with that technology, RFID, and specifically RAIN RFID, is a powerful technology that provides businesses a strategic advantage by harnessing real-time visibility throughout the supply chain. So during this webinar, we'll be covering the unique ways in which RAIN RFID is used throughout a variety of industries, but more importantly, how it's used within the healthcare industry and why it is so important for hospital efficiency and patient safety. Next slide, please. But I think that to fully realize the power of RAIN RFID and its impact on healthcare, we have to just take a little bit of a step back and look at the history of RFID. So I laid out this timeline here because I think it shows that even though RAIN RFID seems like a newer technology because of the incredible amount of data it's able to produce, it's actually been around for a while. So let's dive in about the background. In 1959, identification friend or foe became fully functional. And for those of you who aren't really familiar with this, IFF enables military and civilian air traffic control to identify whether aircrafts are friendly and also to determine their range. And this defense response was created by Robert Watson Watt during World War II. And this was sort of a precursor to RFID because it was using radar to send out coded radio signals to aircraft, and then those aircraft would have the IFF transponder on the aircraft, and then they'd pick up that signal and send back something that said, hey, we're friendly, don't shoot us. In 1961, R.F. Harrington developed an electromagnetic theory related to RFID application, and his published works aided in the study of antennas and waveguides. And then in 1966, we're seeing security checkpoints and anti-theft devices using RFID for commercial use, which led to the greater adoption that we really see in retail and airlines today. 1973 brought about the patent for passive RFID transponders that is used to unlock doors without a key. And this is something that you see today with certain RFID enclosures, such as cabinets and refrigerators and freezers. And it's actually something that we at Terso Solutions utilize in many of our devices. From 1987 to 94, we're seeing RFID being used in transportation and freight services. And then by 99, the Auto ID Center at MIT was established, which changed the way that RFID was thought about in the supply chain, because it really allowed people to realize the full capabilities of this technology. The fact that data could be collected and then transmitted to the internet for information such as shipment arrivals, departures from warehouses. I mean, this was huge. And then from there, you know, you're seeing a lot in the early 2000s, a lot of patents are being submitted. And then by 2003, this is kind of what the 2003 is like the year where we're really noticing RFID technology being put on the map through an announcement that Walmart made, where they said that they would have their top 100 suppliers tag every case and pallet entering their distribution centers with RFID. And of course, with implementing like a newer technology into their space. There were some hiccups, but according to a study done by the University of Arkansas, the trial showed a 16% reduction in product stockouts, and the stores that were using RFID were 63% more effective in replenishing out-of-stock merchandise. Can you click the next slide, please? But you may be thinking, all right, you showed me this amazing timeline that you put a lot of work into, but all of this history also led to a bunch of other types of RFID technology, such as active tags, LF, and HF solutions. So why RAIN? Why UHF? Well, for starters, each tag has a unique item identification, meaning that it can be tied to specific items that you're trying to track. And also thousands of items can be identified at once without being visible. And since it's passive technology, it does not require batteries. But really, to get at the heart of it and the heart of UHF, it's the fastest growing segment on the RFID market. Pharmaceutical companies, medical device manufacturers, life sciences, and biopharmaceutical companies all have recognized the benefits of RAIN RFID, especially when it comes to tracking high-value inventory that aids in patient safety, improved care, and scientific discoveries. So the majority of new RFID projects are using UHF as opposed to HF and LF systems. And to date, UHF technology has over 20 billion connected items, providing real-time visibility and data to countless everyday items. So another aspect is that UHF systems are known for their long read ranges, and they can, it's up to about 40 feet, whereas HF systems carry a much shorter read range at about 3 feet. So UHF allows for faster data transfer rates, up to 20 times the amount and the range and the speed of HF systems. And this enables quicker transaction capture times and faster data processing. And I guess this is the entire point of this presentation, and what we're really trying to get at is that we are trying to optimize supply chains. And so if you're not getting the full range of benefits from the technology, what's the point of implementing it? Next slide, please. So who's using RAIN? Well, there's over 100 retailers right now using RAIN RFID. Companies like H&M, Levi's, Old Navy, and Target are all adopters of this technology. Next slide, please. And Target in 2017 released an article explaining why they incorporated RAIN into their stores, and Carrie Jones, who's the Executive Vice President of Global Supply Chains and Operations at Target, had this to say. You probably wouldn't notice these new RFID tags on your own necessarily, but that's the point. This unobtrusive but significant technology will increase efficiencies by providing greater visibility into our inventory. That means guests will better be able to find out whether we've got an item at their Target store or at others nearby. We also expect RFID to help us better fulfill online orders placed for store pickup, which already account for 15% of Target.com purchases. Next slide, please. So what this establishes is that it is being widely adopted and it is successful within that retail space. But looking at airlines now, we all know that travel is a total pain. When we could fly, checking a bag was a very stressful situation because you're thinking, well, this is the last time I'm ever going to see my luggage ever again. But this once dreadful situation has become somewhat pleasant now, and at least in my experience. So when I use the Delta app, which I have a picture here that shows their app of being able to, check in for flights and track your bags, I'm instantly greeted with the Delta app confirming that my bag's been placed on the plane. That then when I am going to my layover destination, that my bag has arrived at that location. Then once I've boarded, I'm getting a notification that my luggage is now being boarded on my plane to go to my final destination. And then when I arrive at my final destination, it will tell me what carousel to pick up my bag from. And so all of this to say that air travel is different now because of RAIN. And actually in 2007, Airlines lost over 47 million bags and cost the industry more than $4 billion just to deliver the bags that have been delayed or lost. But now airlines like Alitalia are reporting that their mishandling rates have been reduced by more than 40% thanks to RFID technology. And you can kind of see the background of this evolution of how it's evolved within this space. Next slide. And then finally, Steve, if you want to play this, and we can watch it. I don't think we're going to watch the entire video, but I can kind of speak to this. That Rain in manufacturing, we're seeing the various levels of impactful data from how Rain can contribute to the various components of a vehicle, such as tires. So you have level 1 where you're just identifying the tire. Who does the tire belong to? In this case, it's going to belong to Alfred Rain in this video. And you can also, if we don't get to the entire video, this is on the Rain website. So be sure to check this out because it's a great video. Level 2 is identifying the tire. So it's Alfred Rain, and we also want to know some of the sensor data. So what needs to happen with this tire? Well, Alfred Rain's tire needs to be replaced. But then at level 3, we're also identifying the tire, we're acquiring that data, and then we're helping the business make a business decision based off of that data. So in the case of this video, Alfred Rain didn't fill up his tire pressure or didn't fill up his tire. So his tire pressure was low, and thus he voided his warranty. So he will be paying out of pocket for that repair. Next slide, please. So we've learned a little bit about Rain in retail, in airlines, manufacturing, but what about Rain in healthcare? That's what you're all here for. You don't really want to know all about retail. So let's get into that. So looking at a high-level overview of 4 large use case categories, Rain assists in asset tracking and management as for number 1. Steve, can you go to the next slide, please? And asset tracking and management can be anything from loss prevention, patient field tracking, real-time location systems, IT asset management. And next slide, please. In the case of Aarhus University Hospital in Denmark, this type of asset tracking was so needed because this hospital is massive. It has over 10,000 employees and space covering over 124 acres. Aarhus needed to be able to register the location and identity of mobile objects at any given time, which was really difficult considering how large the facility was. Next slide, please. So hospital staff needed to know the current location for things like hospital beds, IV pumps, wheelchairs, and more. So Lungso Systems was able to create a solution for them by installing 2,500 read points, RFID read points throughout the hospital, which provided them that much needed visibility that they wouldn't have otherwise. And then next slide, please, Steve. So it also spans to inventory and supply management. So this could be pharmacy automation, tissue, specimen, and implants, high-value medical devices and implant tracking, and surgical instrument tracking, such as donor kits or other supplies that are used in the OR. And for this, we can look at IntelliGuard as an example. Next slide, please. So IntelliGuard has a Rain RFID enterprise platform or ecosystem, if you will, and it targets pharmacy through RFID-enabled kit and tray processing. And this allows pharmacy staff to scan more than 150 items within seconds. And this is providing details of missing, expired, soon to be expired, and recalled drugs. It also targets anesthesia through RFID facilitated remote clinical access stations, which securely stores medications and narcotics in the OR and specialty areas. And this allows to kind of bridge the gap between pharmacy and the operating room, allowing them to get automatic updates. And then smart cabinets through RFID-equipped control temperature cabinets used to track and monitor critical inventory and their storage conditions. And then finally with the IntelliGuard Insights, which provides predictive analytics about the inventory. Next slide, please. And it also can be used to help with patient care and experience, which is hand washing, monitoring, infection control, patient flow, patient registration, admission and discharge, and bed management. And next slide, please. And speaking of bed management, and going back to Aarhus and Elizondo as an example, Aarhus needed to know the location of the bed. That's one aspect of it. They needed to know where the beds were located throughout the facility. However, they also wanted to know the current status of the bed. And so Elizondo was able to create a bed touchpad that allowed hospital staff to easily select if the bed was clean, contaminated, ready, or occupied. And so this type of communication is essential for hospital efficiency and patient comfort. Next slide, please. So lastly, there's healthcare supply chain and management, which covers things like anti-counterfeiting, drug supply chain security, and consigned inventory. And I'm going to actually dig in a little bit deeper on this because this is an area of focus that Terso specializes in, and I can provide a greater insight on just how impactful RAIN RFID is within this space. Next slide, please. So one of our customers, who's a global leader in eye care and intraocular lenses, needed an inventory management solution that would help give them insight to their consignment program. So first, they needed their sales reps to be equipped with a device that they could take to multiple locations, but that also had the power to read thousands of tags in seconds, which is an extremely lofty goal. So Terso, along with RAIN RFID, we were able to meet this challenge head on and provide a mobile solution that is made up of an RFID reader or device and a software solution along with a mobile device. So they're able to quickly identify expired products and locate recalled or expired products with the locate feature on the device. And what's so great about this and the results with this case study is that the reps were spending 4 hours spending time at the facility auditing, and it would take 4 hours to get through that process. And that process was pushed or consolidated, I guess, down to 30 seconds. So they were able to capture this large amount of tags within 30 seconds and reduce the amount of time that they had to spend manually auditing all of these different products. And not only that, but their customers, because it's such an easy to use and simple technology, that they are allowing their customers to do these audits for them, so they don't even need to actually be in the space if their customers feel comfortable doing that. But this particular use case was for field reps that were trying to have a greater control of field inventory, but there's actually many different applications for this technology. And one example, and I don't know if this video is going to work, I think we were having some issues with it earlier, but Steve, if you want to try clicking that. If not, no worries, I can talk about it. Oh, great, so it is working. So this example right here is trunk stock. So if there's limited visibility from medical device manufacturers for inventory that's kind of on the road and traveling. And so this is showing just how impactful a technology like this is, because with the RFID handheld device, this video shows you can capture 300 tags within 3 seconds. And this gives medical device manufacturers that visibility that they desire. And it really, I think, shows the power of RAIN technology. So next slide, and I think that this is an area we're going to pause for a polling question. So we kind of want to hear what you have to say. In your opinion, which of these do you think is the most compelling use of RAIN RFID adoption? I.e., where do you think that RAIN would make the biggest impact? Is it asset tracking and management, healthcare supply chain management, inventory and supply chain management, or patient care and experience? Weigh in, we want to know.
So let's see, we're seeing some people voting here. Just give you a few more seconds. About half of you have voted so far. Ten more seconds. Okay, 5, 4, 3, 2, 1. And there are the results.
Oh, this is great. Wonderful. Paul, I don't know if you want to weigh in on this, and then we can kind of hand things over to you and take it, and you can take it from there.
Thank you, Kristine, for reviewing some of the compelling applications of RAIN in healthcare. What I would like to say is we have limited time today, and so we have many more case studies on the website, and we encourage everyone on this call to please visit our website and visit the healthcare webpage to review many different case studies describing compelling applications of RAIN in healthcare. Thank you very much, Kristine. That was great.
My pleasure, Paul.
So I think we can go to the next slide, Steve.
There we go.
All right. So last year I bought some underwear, and I think all the men on this webinar know that we'd rather dig a trench in our backyard than buy underwear, and so it's a traumatic experience for me, made all the more traumatic by finding a RAIN tag on my Tommy Hilfiger underwear package. I couldn't help think of the irony that some poor supply chain guy at Tommy Hilfiger woke up every day and looked at his computer to see how my underwear was moving through the supply chain. And in the meantime, we have millions of medications moving across the supply chain on our planet that we know nothing about. So I keep this on my desk every day to remind me that we need to do something about this, and we need to revolutionize the way we track medication, and RAIN can bring that about. I believe passionately that RAIN will one day bring that about. Next slide. So how big is the pharmaceutical market? Kristine just mentioned a moment ago that the airline has a $4 billion baggage loss problem. That's a lot of money. The pharmaceutical market is over $1 trillion today. In 2019, it was very near $1 trillion, and this shows a little bit more in 2018. But it's depending on what the source is. It's a big market. Next slide. What are some of the challenges that pharma companies and distribution companies are facing? The World Health Organization estimates that counterfeiting is a $200 billion problem. $200 billion. And that internet sales account for about 75 billion. Now, to know that there's really a problem here, you just look at how much is spent on anti-counterfeiting packaging. And today, the industry spends $106 billion. And by 2027, that'll be $216 billion. Right there, that tells you that there's a problem with counterfeiting medication. Next slide. Diversion. Diversion is real. And diversion is a fancy word for theft. And hospitals across the world have big problems with diversion. As you can see here, among healthcare providers, estimated that 15% of pharmacists, 10% of nurses, 8% of physicians are challenged with alcohol or drug dependency. And that means 43,000 of our medical professionals just in the US alone could have a problem with diversion. There's a study that states that 19% of anesthesiologists at one point or another in their career have a problem with diverting anesthesia medication. Here in California, 4 years ago, a hospital's plumbing was stopped up, and they kept moving down the plumbing and the sewer line until they found a plumbing grate that was completely clogged with narcotic vials that had been diverted and flushed down the toilet. So this is a real problem, not just in the U.S. but across the planet. Next slide, Steve. Every hospital has this problem, and it costs them in many, many different ways. There's disruption, employee impact, fines, jail time, reputation. And the thing I didn't list here is the potential for medication errors and other errors that directly affect the health of patients and the quality of care to patients. And that's why hospitals exist, to care for patients, to cure patients, and that is directly affected by diversion of medication and narcotics especially. Next slide. So last year, I saw this advertisement from Avery Dennison, which is one of the world leaders in identifying items, not just with RAIN, but with NFC and barcodes and QR codes, and they publicized the fact that they now have the capability to track a sweater through the supply chain and tell you where the cotton was picked and how it was picked, and was it organic, and where it came from, and was it woven, stitched, dyed, was it transported at the right temperature, et cetera, et cetera. And I was struck by this advertisement because I thought to myself, this sweater will not ease the pain of suffering, cure an illness, save a life, prepare a patient for surgery. None of these extremely critical things that medication provides to patients around the world. And I just, again, I thought, what an irony that the retail industry has successfully implemented solutions for tracking a sweater, but we know nothing, again, about millions of medications. Some of them low temperature medications, whose efficacy depends on those medications being stored from 2 to 8 degrees across the enterprise. And we know nothing about those medications. Next slide. So Kristine said you didn't want to hear anything more about retail, but I'm going to tell you a little bit more about retail. I like to say retail is winning because retail last year deployed over 18 billion RAIN tags to track items across the supply chain. And you can see on the top line here that that the healthcare actually deployed 1.481 billion RFID tags. Most of those are other frequencies and not RAIN or UHF. So I like to say that retail is winning, and they have benefited from the implementation of RAIN to track items across the enterprise. Next slide. So the benefits are sales increases, obviously inventory accuracy results. There are retail chains that are using robots to take inventory in the evening while the store is closed. Decathlon in France is tagging all of their sporting goods items. And now you go to shop at Decathlon and you take the items that you would like to purchase, you put them in a bag or put them in a cart, take them to the front, they put them in a box and they read them all. And then you make the purchase. They have RF-enabled shelves. They have RF-enabled room readers. And so retail has definitely taken advantage of the capability of RAIN and the non-line of sight that's required, that non-line of sight capability to improve their supply chain. Next slide. Kristine?
Thanks, Paul. Sorry, I had to unmute myself. So we're ready for polling question number 2. So what do you believe is slowing the adoption of RAIN RFID within healthcare? Do you think it's cost? Do you think you just don't have enough information at this time? Is it learning a new technology? You don't really see an ROI? Or is it lack of integration to EHR? Weigh in now.
Okay, we have about half of you. Couple more seconds here. Get your votes in now. 5, 4, 3, 2, 1. Okay, polling ended. And results.
Oh, interesting. So most of you say learning a new technology.
Okay, thank you very much. That's good information for us in the RAIN Alliance, as our objective is to educate all industries about the capabilities of RAIN and to make the stakeholders across all the industries aware of the capabilities. And so we appreciate this input very much. Okay, so in the 10 years that I've been working in implementing RAIN solutions in healthcare, I have heard that some of the barriers, some of these are firsthand knowledges, and other barriers I've heard from other stakeholders in the industry. But what are the barriers to pharma adoption? Pharma says we're nothing like retail, and that's true. I mean, it's a much more complicated supply chain, and it includes a cold chain pedigree. We've got narcotics, controlled substances, critical medication, very high value medication. Modifying the labels has to go through the FDA. There's no industry agreement on numbering. Yes, GS1 has provided resolvable, interoperable, open numbering systems, but healthcare needs expiration and lot number, whereas retail does not. So disparate vendor solutions prevent end-to-end supply chain usage. Resistance to RAIN, I've heard this from some entities, that the improved inventory management and visibility leads to the elimination of expired meds and safety inventory. That means loss of sales. And some pharma companies are concerned about the greater visibility of their supply chain. I like to look at it and say, imagine if the FDA had visibility of the opioids moving through the supply chain 10 years ago. They would have seen the opioid crisis coming. They would have known that enough opioids were being shipped to Virginia for every man, woman, and child to have one per day for the entire year. Another thing that's happening in the US, which I have heard is threatening, is IDNs, integrated distribution networks, which are big networks of hospitals. And these hospitals form together to have greater buying power and to have greater efficiencies. And we did a study at IntelliGuard 2 years ago in which some of the chief pharmacists across the country stated that over the next 10 to 15 years, the 5,000 to 8,000 hospitals in this country will gather into about 200 IDNs. And so some people see that as a threat because they're saying that the IDNs are going to start buying directly from pharmaceutical manufacturers, cutting out the warehousing and distribution in the middle. And some people see RAIN as enabling that process. Next slide, please. So, GS1, there are entities looking at how we're going to track medication across the supply chain. And GS1 has a healthcare initiative that has described or defined a digital thread whereby stakeholders can track items from the raw materials to the manufacturer, to the hospital, to the patient. And GS1 provides all the numbering systems to accomplish this efficiently. And they provide a system of sharing the data called EPCIS, where you share the GTINs, those are the global trade item numbers, the SSCCs, serial shipping container codes, and the GLNs, the location where a business event occurred. And all that is shared through the cloud using EPCIS. And you can see that visibility is given to the public entity authority here, which is in our case in the US, the FDA. RAIN enables this digital thread. Senator Hawley in February here in the US from Missouri, Senator Hawley from Missouri introduced a bill into Congress to increase the visibility of items moving through the medication supply chain to the FDA. RAIN enables his vision. Next slide. There is infrastructure going into hospitals, and that can be used for this process and can be deployed, or yes, I guess they can be deployed for enabling the tracking of items through the supply chain. Simply RFID has 3,000 RAIN-enabled refrigerators across hospitals, pharmacies, doctors' offices. Next slide. Terso Solutions has 3,500 global implementations, 500 US hospitals implementations. All of these smart cabinets could be used for tracking medication in hospitals and across the supply chain. Next slide. Continuum by DeRoyal is tracking hospital supplies. And you can see that they have 115 customers and have deployed over 1 million tags. They have RF-enabled shelves and kiosks whereby hospitals can track items and track inventory within the hospital. Next slide. IntelliGuard, as mentioned by Kristine, is deploying dispensing stations, RAIN-enabled dispensing stations that allow hospitals to track an item to the patient, to the individual patient, to do accurate charge captures and to make healthcare professionals accountable. There are now 75 of these units deployed across hospitals in California, and in every one of those hospitals, the pharmacy and the administrators in those hospitals know exactly what is being dispensed in which OR to which patient, making every single anesthesiologist accountable in those hospitals. Anesthesiologists are the only profession in healthcare where the pharmacist and the doctor are the same person. And that is one of the biggest areas for diversion in our acute care facilities in this country. Next slide. Kristine?
Yeah, thank you. So we've learned a little bit about how RAIN is being used within healthcare. We've presented some case studies. So we're curious to know where you think the market size is heading. So answer this question or try to guess the correct answer here. According to a 2019 Grand View research report, by 2025, the global RFID healthcare market size is expected to reach what in US dollars? Is it 250 million, 500 million, 5.75 billion, or 10.65 billion? Let us know.
All right, just about 50% of you have voted. A few more seconds, get your votes in. 5, 4, 3, 2, 1. All right, and let's share the results.
Okay, so most of you said 5.75 billion, when in fact the correct answer is over $10 billion. That's where it's expected to reach by 2025, which is not far off. So that's pretty exciting and really shows where RFID is heading.
All right, thank you very much, Kristine. Let's go to the next slide, please. So the future of healthcare, we see improved efficiencies, obviously, and freeing. What we like to say at IntelliGuard is RAIN allows healthcare professionals to practice at the top of their license and actually treat patients as opposed to worrying about inventory. RAIN automates the management of critical inventory. Short expiration medication, high value medication, narcotics, controlled substances. RAIN automates all of that, allowing professionals to actually treat patients. So we see elimination of all this labor by these professionals and improvement in all aspects of inventory control. Next slide. So, I believe passionately that RAIN will revolutionize the way we track medication on this planet. And 5 to 10 years from now, we're going to look back and we're going to say, how did we ever manage such a complex process without RAIN? We, in the RAIN Alliance, we passionately believe that RAIN will have anti-counterfeiting benefits, anti-diversion benefits, will provide e-pedigree, cold chain pedigree, ambient temperature pedigree of medications. It will improve operational efficiencies. It satisfies all the requirements of the Drug Supply Security Act, serialization, sellable returns verification, recalled drugs. It allows us to find recalled drugs accurately. And within acute care facilities, it allows us to authenticate medication and ensure that it is not counterfeit and that it has efficacy. It makes healthcare professionals accountable. It creates operational efficiencies, and it provides regulatory compliance for narcotics and controlled substances, which are required here in the US. And so, yes, it's definitely worth implementing RAIN across the healthcare enterprise. Next slide. What can we do to accelerate the tagging of medication with RAIN at the source. The RAIN Alliance is working with the pharmaceutical industry, the FDA, Senator Hawley, to promote the use of RAIN and tagging with RAIN at the source. We need to support GS1 standards. GS1 is currently looking at adding a command to the protocol that will allow us to read not just the EPC, whether that EPC is an SG 1096 or 198, but also read the expiration and a lot number in user memory. So that can be done all in one command. That will facilitate the adoption by pharma. We need to support the GS1 US Healthcare Initiative, which is describing all the different scenarios of how items move through the medication supply chain and how they can be returned and tracked. We need to engage with the FDA to promote RAIN, engage with pharma industry, demonstrate the power of RAIN through pilots, and then do what we're trying to do, and that is educate stakeholders across the enterprise to promote RAIN. Next slide. So in the future, I'd like to see an Avery Dennison advertisement that says it's not just a generic drug, because we want to know where the ingredients were sourced, who made it, the efficacy, the authenticity, when it expires, where it came from, the cold chain pedigree. And we have to remember that a patient is at the end of the supply chain, of the medication supply chain. It's not a customer, wearing a belt from Macy's or a shirt from Tommy Hilfiger. It's a patient, and it could be one of our loved ones at the end of that supply chain. Thank you very much.
Great, thanks, Paul. So also we can just kind of wrap up this webinar with our fourth polling question, and we talked a lot about education, and that's what we're really striving to do, is educate stakeholders about RAIN in healthcare. And about polling question number one, we saw that, polling question number two, we saw that learning a technology might be the biggest barrier. So what resources do you believe would be most beneficial for receiving information about RAIN in healthcare? What would you like to see when it comes to getting that kind of education, and what format? Is it case studies, white papers, videos, ebooks, or webinars?
I see. Almost everybody's voted. 4, 3, 2, 1. There are the results.
Great. Case studies. That's wonderful. Case studies followed by webinars, and we've kind of done both in today's presentation. We've done a webinar where we've presented a lot of great case studies. So we will keep creating content that showcases the benefits of the solution in real spaces. I think that is also a really great resource.
I see that there's a couple of questions here. Chris Brown asked, what is EHR? EHR stands for Electronic Health Records. I think Yuha Polvela has asked, are there many ICs with this authentication possibility? I think it's Juha. I'm sorry if I'm mispronouncing your name. All RAIN ICs have the capability to authenticate the item using the unique ID that is on every RAIN IC. So you can tie the EPC, the identifier in the EPC memory can be associated with that unique ID for that IC in a database, and then you will never have that combination with any other RAIN IC, and that is the authentication capability of RAIN.
Yeah, and Juha also asks, or made a comment, I guess there's no way to read the RAIN objects with mobile phones since only the NFC are implemented to phones, right? While NFCs are implemented to phones, with the case of, and I don't know if you're referring to the RFID handheld device, but in that case, it's using Bluetooth technology to connect RFID device to the mobile application.
Thank you, Kristine. One last question from Juha is he's asking about 128 AES encryption. No, currently there are no RAIN ICs available that provide encryption. However, it is.
That's not true, Paul.
Oh, okay. Thank you. Oh, you're right. That is not true. I'm sorry.
There's at least two that I can, two manufacturers that I can think of. That...
Yes, I am. I beg your pardon. There are at least two, and we can get you that information. We can get you that information if you'll give us your contacts.
We have that.
Okay,
just to go back to the previous question, which was about NFC. So you're correct. Current mobile phones don't read RAIN tags. Though I do have a mobile phone on my desk that does read RAIN tags. So at some point in the future, we should expect that they're coming. But if you join the webinar in 2 weeks' time, you'll hear from one of our members who has a RAIN and NFC tag in one, so that you can use your mobile phone to address the same memory space that the RAIN is using as well. So I want to say thank you to our speakers.
Yeah, thank you for having us.
You're very welcome. Paul and Kristine did a great job, I think. I think we went through most of the questions that were there. We've kind of run out of time today, but if there are questions that you've still got, feel free to post them right now and we'll get you answers in the future. As I said to you before, both the video and the slides will be available in a few days when we have everything processed, and you'll all get an email about that. So thank you for joining us today. Hopefully you'll join us again in 2 weeks and learn more about the interaction of RAIN and NFC. Thanks everyone for joining us. Bye.
Thank you everyone. Bye now.
Thank you.